recognition of it. Very soon thereafter, it was found in the drug abuse population, individuals who use intravenous drugs, street drugs now we're talking about. It was found, obviously, in patients who are hemophiliacs and require large volumes of blood transfusions. It's lately been recognized in children of people who have AIDS or who carry the virus. The mode of transmission there is not entirely clear, but that's a risk factor. And ever more frequently now, we see cases reported in the regular heterosexual population, those individuals who are not drug abusers, and they're not homosexual or ever had any homosexual activity. They're regular people who are having heterosexual relations with others in the community. That's the largest growing category right now.
Can a woman give AIDS to her lover or her baby?
The answer to that is yes in both cases. It was once thought that women were not susceptible and could not transmit the virus. That's clearly not the case. There are actually more women than men with this disease outside the United States, particularly in Africa. And there the transmission is clearly from male to female and female to male in a regular heterosexual fashion. Women can also give this virus to their children. It's less clear how they do that. In the other case, when we're talking about male to female transmission in an adult setting, we're talking about sexual intercourse. Intercourse which involves vaginal sexual intercourse. In children, in the case of children, it's not so clear. They probably acquire the disease from their mother about the time of birth, maybe even just a little before birth, in most cases. But there also are cases reported where the individual has acquired the virus at a later date, maybe at age year 1, year 2, something like that. So we're not exactly sure how it's being transmitted, but it would appear to be physical contact that would have a role in this in some fashion. And the earlier the better, in terms of transmission ability anyway.
If your doctor sterilizes all non-disposable equipment regularly, changes disposable instruments between patients, and as long as a mask, gloves, and protective eyewear are worn, the risk of contracting AIDS is almost non-existent. There's a lot of myths about where exactly AIDS came from and how it got to the United States. Could you tell us, to the best of your ability, where AIDS originated?
The AIDS virus, which is called human immunodeficiency virus, or HIV now, it's been renamed several times, is theoretically a mutation of a monkey virus from Africa, which was transmitted to humans in Africa sometime in the 50s. And then the virus became more prevalent in that country and found its way eventually to the other parts of the world, probably around the time of the travel revolution, which occurred in the late 60s and early 70s. And international air travel, for instance, became very easy and very much available to people from a financial point of view. And that's when the virus began its great migration and found its way eventually to our shores.
Once a person becomes infected with the AIDS virus, is it imminent that they will die?
So far as we understand the situation now, all patients infected with this virus will ultimately develop the acquired immunodeficiency syndrome itself, ultimately, if they're not killed by something else sooner. And all those patients will die of the acquired immunodeficiency syndrome. The answer to your question is, with our current knowledge, yes.
Can you estimate how long most of those people have to live after they have actually acquired AIDS?
Right now, the average length of lifespan after diagnosis is probably something in the vicinity of 3 years. This is growing a little longer as time goes by. Our ability to keep these people alive and to handle their complications is improving. And so as a result, they live longer than they did before. We hope that this will even stretch beyond the 3-year mark soon. But right now, that's the figure that most people are using.
Is this 3 years of misery, sickness in and out of hospitals, or can a person lead a normal life during the time that they have AIDS?
In the early stages of the acquired immunodeficiency syndrome, after the first hospitalization usually, many of these people can return to a relatively normal lifestyle, but they are not well, and they do not feel good. They are always sick with one thing or another. The average patient during their 3 years, and that 3 years is an average, by the way, there are certainly people who live longer than that, is hospitalized about 3 to 4 times. And with each succeeding hospitalization, their degree of illness and disability increases. I would have to say that on the average, with my experience of my patients so far, that patients who have gone through this have 3 years of a pretty miserable life.
The following is a dramatization. Jeff is a young man attempting to live with the illnesses, hospitalizations, and misery so common to the victims of AIDS.
When I was 18, when I told my parents I was gay, felt it was the thing to do. My mother took it pretty well. I guess as well as you could take it. My father hasn't talked to me since. So to make things easier, I decided to move out. So a friend of mine and I got an apartment, and it was fun for a while. And then there was this big AIDS thing going around. So we decided to get tested. His results came back negative, and mine came back positive. He was supportive for a while, I guess as supportive as you could be. But then one day, he came home, and everything was gone. It was all gone. My sister's moved in with me since, and she's been a really big help. She's really helped out a lot. Not really sorry for anything that's happened in the past, who I am, what I am. Biggest regret that I do have is not to have practiced safer sex. And the doctors told me now I had 2 years to live. And now it's too late.
Though you may not consider yourself to be in a high-risk group, you must be tested. The fact remains that you're better off knowing whether or not you are infected. The test is quite simple. It is an ordinary blood test, which must be taken. Taking it once, however, is not enough. Each person should be tested regularly for the antibodies. If you are tested negative, it doesn't necessarily mean that you are not infected, for the virus can hide in a person's immune system for over 12 months. Should you be tested positive, it is imperative that you know, for the safety of others as well as yourself. Then you may be placed in the hands of a competent physician and begin treatment. Although there is no cure for AIDS, there is a drug which prolongs the life of the AIDS victim by slowing down the replication of the AIDS virus. This drug, called AZT, was developed by Dr. Samuel Broder of the National Cancer Institute. It was released in September of 1987. Now all AIDS patients, knowing the risks and side effects of AZT, and under the care of a licensed physician, may obtain the drug from their pharmacist. AZT involves many risks and side effects. They are anemia or low blood, toxic shock, recurring nausea, and severe headaches. Other effects may exist that have not yet been identified. Very simply put, AZT provides a false building block for the HIV or AIDS-causing virus. Dr. Broder states,
the metaphor that I like to use is that it is junk food in the same way that a teenager might like junk food. The virus likes AZT almost better than its normal constituent building blocks. What that means is that the virus will be fooled into accepting AZT in its activated form. And once it incorporates AZT as it replicates, it becomes terminated, it dies.
unprecedented progress has been achieved in the search for a cure. Other treatments currently being tested are interferon, interleukin-2, surgery, radiation, and other drugs. Treatment is very important to the infected person. The only thing more important than treatment is prevention. Its route of transmission is predominantly sexual. It is transmitted from men to women, from women to men, from men to men, and from women to women sexually. That qualifies as a venereal disease. The facts on AIDS prevention are clear. Take an active role in saving your life by using the information available on avoiding the AIDS virus. Different official sources have the same answer, said United States Surgeon General C. Everett Koop.
The best protection against infection right now, barring abstinence, is the use of a condom.
Head nurse Patricia Martin of Marywood College commented,
AIDS does not discriminate against its victims. Much information is available on the prevention of AIDS. The only absolute way of preventing AIDS is abstinence. Avoid contact with the virus.
What we have to remember is that AIDS is everyone's problem, not just the people who have AIDS. Each of us has tremendous power. AIDS is a disease of choice. It's a disease of behavior. It's up to each one of us to make the right choice and change our behavior.
In closing, Dr. Stephen Pancoast had this to say.
I think the most important message to take away from this problem is a simple one, and it's not complicated to consider, although perhaps from a human point of view it's very difficult to react to or to conform to. Since this virus as we know it, once it infects an individual, results in their death, and that process is not modifiable really very much by medical science as we know it today, and it looks as though any effective prevention, treatment, vaccines, or whatever else you'd like to call them, are somewhere in the future for this. It's clear that what persons have to do is to not contact this virus in the first place. That's relatively easy to do. We know how it's spread for the vast majority of people. There are small areas of uncertainty, surely, but we know for absolute fact that the major risk factors are promiscuous heterosexual behavior, homosexual behavior, particularly male anal receptive intercourse, and blood transfusions. Blood transfusions now I'm speaking of the sort which you get with sharing needles and so forth and drug addiction. It is therefore very easy to avoid contacting this virus by avoiding that type of behavior. Now, the human condition being as it is, it may not be possible for an individual to modify their lifestyle such that they can avoid these things totally. But surely we can cut down in all cases. And a person who wants to avoid this disease can do so relatively easily. And I think that any thinking person in this country today should do that. If it's still necessary, for whatever reason, for a person to behave in a social fashion which requires contact with multiple individuals, or even individuals whose background that you don't know very well, then the use of condoms for sexual intercourse is absolutely essential. They are protective. They have been proven to be so. And I think that all of our moral, religious, and other restrictions on the use of these devices have to fall by the wayside. They're being used or being recommended by authorities all the way from the federal government on down to the public health local level. And I think that this message should be communicated to all people. And hopefully, with the use of these devices, transmission of the virus will be at least lessened, if not abolished.
We're talking about death here. We're talking about death.
I'll do a lot for love, but I'm not ready to die for it.
It's too late for the victims of AIDS, but it's not too late for you. 3 out of 10 reported cases of AIDS are heterosexuals. 6 out of 10 are homosexuals. 8 out of 10 are intravenous drug users and hemophiliacs. 10 out of 10 can be prevented. The preventative measures are left up to you. For local testing and more information in your area, call this number. You now have the knowledge to stop the spread of rumors and to stop the spread of AIDS.